Groot, and I'm a nurse practitioner here at Janning ENT Center, and I'm excited to take care of you and your children. Today's topic is ear infections. So if you have any little children or you've been around children, you've probably heard of the topic ear infections. And especially this time of year, going into winter, we do tend to see more ear infections. And you might ask, why? Some of that is because the ear, nose, and throat are all connected. And as you also know, kids have a lot of snot. So in the winter, lots of runny, stuffy noses, lots of colds. All of that fluid mucus buildup can cause fluid and mucus to build up behind the eardrum as well, and therefore lead to an ear infection. So that's why they're more common going into the winter season. So you're also probably wondering, well, why would I need to see an ENT specialist? This is important if your child has had 3 infections in the last 6 months or 4 ear infections within the last year. Also, if you just have any other concerns or questions, or you don't feel like your child is responding as well as they should to antibiotics or the treatment that your primary care provider has provided, then feel free to make an appointment, come in, and we can talk about different options and things that might be helpful for you or your child with their ear infection. You're also probably wondering, how can I prevent my child from having ear infections? Which is a great question. One of the things would be to control allergy symptoms. So if your child does have a runny nose, a lot of sneezing, itchy eyes, or they're doing this what they call allergic salute, then they probably have some sort of allergies. Now you certainly could see an allergist, otherwise there are medications that can help control allergies as well. Because again, if the nose is stuffy and runny, then that can cause more buildup in fluid in the ears and more ear infections. So prevention can be controlling allergy symptoms. The other thing is that we do know that children that are exposed to smoke in their homes have an increased risk of ear infections. Also, if you're able to, breastfeeding within the first 3 months of your infant's life can be helpful for the first full year to prevent ear infections as well. There's also general recommendations, just taking your child in for their well visits, updating their immunizations, eating a healthy diet, trying to get good sleep at night. All of those things can help prevent ear infections as well. So hopefully this was helpful for you today. It was a little general, so of course if you have specific questions for your loved one or your child or for yourself, please feel free to contact our clinic.